Good afternoon. This is Shannon Knutson with Indiana State University. This is a health presentation for Community Health Nurse 444. Today we're going to talk about stroke alert and how we can be fast in detecting a patient or one of our loved ones that is having a stroke. So the learning objectives for this presentation are: what are the facts and statistics regarding stroke in the U.S.? We'll take a pretest. Who is at risk for a stroke? How can we prevent a stroke? What are the symptoms of a stroke? How is a stroke treated? How can you learn to detect a stroke? We'll have you take a post-test to see how much you learned, and then we'll review the resources that were used to make this presentation. First, the facts and statistics regarding strokes in the U.S. In 2018, 1 in every 6 deaths from cardiovascular disease was due to stroke. Someone in the United States has a stroke every 40 seconds. Every 4 minutes, someone dies of stroke. Every year, more than 795,000 people in the United States have a stroke. About 610,000 of these are first or new strokes. About 185,000 strokes, nearly 1 of 4, are in people who have had a previous stroke. About 87% of all strokes are ischemic strokes, in which blood flow to the brain is blocked. Stroke-related costs in the United States came to nearly $46 billion between 2014 and 2015. This total includes the cost of healthcare services, medicines to treat stroke, and missed days of work. Stroke is a leading cause of serious long-term disability. Stroke reduces mobility in more than half of stroke survivors age 65 and over. So we'll talk about stroke statistics by race and ethnicity. Stroke is a leading cause of death for Americans, but the risk of having a stroke varies with race and ethnicity. Risk of having a first stroke is nearly twice as high for Blacks as for whites, and Blacks have the highest rate of death due to stroke. Though stroke deaths rates have declined for decades among all race ethnicities, Hispanics have seen an increase in death rates since 2013. I'll have you take a pretest, pause the video, click on the link just under the presentation that looks just like this. When you're done, come back and we'll continue on. Thank you for taking the pretest. Now we'll move on to risk factors. So who is at risk for stroke? These are the leading causes of stroke: high blood pressure, high cholesterol, people that smoke, people that are obese, and people that have diabetes. 1 in 3 U.S. adults has at least one of these conditions or habits. So how can we prevent having a stroke? You can help prevent stroke by making healthy choices and controlling any health conditions you may have. So with healthy living, by having a healthy diet, healthy weight, physical activity, stop smoking or don't start, and limit your alcohol intake. To control by the medical conditions, you want to always check your cholesterol, control blood pressure, control your diabetes, treat your heart disease, take your medications properly and consistently, and work with your healthcare team. So what are the symptoms of stroke? Sudden numbness or weakness in the face, arm, or leg, especially on one side of the body. Sudden confusion, trouble speaking, or difficulty understanding speech. Sudden trouble seeing in one or both eyes. Sudden trouble walking, dizziness, loss of balance, or lack of control. Sudden severe headache with no cause. So how do we treat a stroke? At the hospital, health professionals will ask about your medical history and about the time your symptoms started. Brain scans will show what type of stroke you had. There are 2 types. The ischemic stroke If you get to the hospital within 3 hours of the first symptoms of an ischemic stroke, you may get a type of medication called a thrombolytic, a clot busting drug to break up blood clots. Tissue plasminogen activator, TPA. This is a thrombolytic. Hemorrhagic strokes. There's endovascular procedures may be used to treat certain hemorrhagic strokes. The doctor inserts a long tube through a major artery in the leg or arm and then guides the tube to the site of the weak spot or break in a vessel. The tube is then used to install a device such as a coil to repair the damage or prevent bleeding. Hemorrhagic strokes may be treated with surgery if the bleeding is caused by a ruptured aneurysm, which is a ruptured artery in the brain. A metal clip may be put in place to stop the blood loss. So, early detection of a stroke. You need to know these signs. Stroke is an emergency. When every minute counts, make sure you can recognize the signs of a stroke for your loved one or yourself. So be fast at detecting these. Balance loss, change in visual, facial numbness or drooping, arm weakness, speech difficulty. If you develop these signs and symptoms, you need to call 911 and get to the hospital as quick as you can. Now we'll have you take a post test. Click on the link below the presentation. Once you're done, come back and we'll finish reviewing the resources that were used to make this presentation. Thank you for taking the post test. Now for the resources, always make sure if you are going to do further research for stroke prevention or any health issue topic that you're using good, credible resources. Two of the ones that were used during this presentation is the cdc.gov stroke and the American Heart Association, www.stroke.org, all about strokes. So remember the stroke warning signs. Be fast. Balance. Is there a sudden loss of balance or coordination? Eyes. Are there sudden vision changes? Face. Does one side of the face droop? Arms. Is there any weakness in the extremities, the arms or the leg on one side? Does your arm drift downwards? Speech. Is the speech slurred or confused, or are you having trouble understanding what people are saying to you? Do you have a sudden terrible onset of a headache? Is the person complaining of the worst headache they've ever had? If you have developed these signs and symptoms, be sure that you are being fast in treatment for this person, for yourself, and you contact 911 to get emergency health care immediately. Thank you for joining in on my presentation. And again, if you need further resources about stroke, stroke warning, stroke prevention, please visit the cdc.gov or the American Heart Association Stroke Awareness website for further information regarding stroke. Thank you.